It only takes one flight, one cough, one unvaccinated person. Now it's 27 states and counting. We thought it was gone. We were wrong. Let's rewind to 2000. The U.S. officially eliminated measles. Gone. Done. Game over. But now, it's back. And it's spreading all faster than anyone expected. As of this weekend, 3 more states, Louisiana, Virginia, and Missouri, have joined the list of places reporting their first measles cases of 2025. That brings the total to 27 states. And we're only in April. What do these new cases have in common? They're all linked to international travel. They involve people who are unvaccinated, or whose vaccination status is unknown. And they show just how fragile our public health safety net has become. Let's break it down. What's happening, what you need to know, and how we can stop this virus before it becomes our next national crisis. The trigger: travel, exposure, and patient zero. It only takes one person on one plane, and a whole state is at risk. This past weekend, the 3 first cases had dropped at once, each one sparking new concerns. Louisiana. An unvaccinated adult in the West New Orleans area, just back from an international trip, tested positive. Officials are scrambling to track down everyone they may have exposed. Virginia. A child under 4 years old, who recently traveled internationally, is now the state's first measles patient of the year. No word yet on whether the child was vaccinated. Missouri. A child, also a recent international traveler, became the first measles case of 2025 in the state. Their vaccination status is unknown. These aren't isolated stories. They're cautionary tales. In every case, a single international exposure brought the virus home. And from there, it can linger in the air for up to 2 hours after someone leaves a room. With travel ramping up, summer on the horizon, and vaccination rates down, that's a hot, dangerous combo. Outbreaks across the map, where measles is hitting hardest. This isn't just a few scattered cases. Entire communities are now in outbreak mode. The CDC says we've hit 800 confirmed measles cases this year. That's nearly triple last year's total of 285. And if we stay on this track, we could blow past the 2019 record of 1,274 cases, possibly hitting numbers not seen since 1992. Here are the 6 states battling major outbreaks right now. Texas. 597 cases, mostly in Bosch, Gaines County, with 2 confirmed child deaths. New Mexico. 63 cases, including 1 measles-related death, under investigation. Ohio. 30 cases in counties like Knox and Ashtabula. Kansas. 37 cases across 8 counties. Indiana. 6 cases in Allen County, all connected. Michigan. 7 cases, 3 of them linked to Canada's Ontario outbreak. These aren't random clusters. They're part of a nationwide web of infections, many with genetic links to one another and to international travel. And the worst part? 96% of this year's U.S. measles cases are in unvaccinated people or those with unknown vaccination status. That's not coincidence. That's cause and effect. The vaccine that could have prevented this. If there was a 97% effective solution to a deadly virus, would you take it? There is a solution. It's called the MMR vaccine, and it protects against measles, mumps, and rubella. Here's what you need to know. The first dose is given at 12 to 15 months, and the second dose between 4 to 6 years. The vaccine is 97% effective at preventing measles. It's safe, tested, and has been in use for 8 decades. Most adults born after 1957 are expected to be immune, either through vaccination or past infection. But if you're not sure, it's totally safe to get another dose. And if you were vaccinated before 1968 with the older killed virus version, you might need to get revaccinated. Talk to your doctor. What's the danger of not getting the shot? Without vaccination, a single case can explode into dozens, especially in communities where Herd immunity has broken down. Why measles is so much worse than you think? It's not just a rash. Measles is one of the most dangerous viruses we've ever faced. Let's clear this up. Measles isn't just a childhood inconvenience. It's a highly contagious, airborne virus that can kill, especially in children, infants, and people with compromised immune systems. Here's what it does. Starts with a high fever, cough, runny nose, and red eyes, followed by a red rash that spreads from the face down. Can cause brain swelling, pneumonia, blindness, and in rare cases, death. And once it's in the air, it hangs around for up to 2 hours. You don't even have to see the person who had it. Just walk into the room they were in. That's why this virus is so dangerous. In schools, hospitals, airports, and public places. And right now, most of the U.S. is not immune enough to stop it from spreading fast. How we got here, and what's still coming. We had this virus on the ropes, so what went wrong? Back in 2000, the U.S. declared measles eliminated. We had it under control, thanks to strong public health infrastructure and our high vaccine rates. But since the pandemic, things have changed. Vaccine skepticism has surged, fueled by misinformation online. More parents are filing for LALT, religious or personal exemptions. Routine childhood immunization rates have dropped, and public health departments are underfunded and overwhelmed. Now, we're seeing the results. More travel, more exposure, fewer protections. And it's not just happening in the U.S. Ontario, Canada, has had nearly 1,000 cases in just 6 months. Mexico's Chihuahua state has over 400. And it's all genetically tied to the Texas outbreak. This is what happens when we take public health for granted. This isn't fear, it's a call to action. We're not here to scare you. We're here to inform you. Because what's happening right now in the U.S. isn't just an outbreak. It's a test. A test of whether we still trust science. A test of whether we're willing to protect each other. A test of how far we'll go to keep kids safe. Measles can be stopped, but only if we act together. So here's what you can do. Call to action. Like this video if you learned something new. Comment. Are people getting vaccinated where you live? Why or why not? I'm sure saying this with a friend who thinks measles is just a rash. And unfollow, subscribe. For more updates on health, science, and the stories that matter. Let's stop this outbreak before it becomes another chapter in a history book. The next case doesn't have to be in your state or your family.